Gynecomastia is basically overdevelopment or abnormal development of the chest in a man. And this can usually start in puberty when the boys are going through their hormonal changes. By a mistake, the body makes a breast gland. And that breast gland creates fullness in their chest, which of course is embarrassing to them. This condition is something you can't lose on your own. You can't go work it out, you can't lose weight and make it go away. It's a gland which has some fat around it. The other way that some people get gynecomastia is guys who use steroids to bodybuild, to play football, all those different reasons. The treatment is really straightforward. You gotta go in, take out the gland tissue directly, and then liposuction the fat and make it nice and smooth and blend it. And of course, do all this without leaving any visible scar. So that's something that we do all the time. It's very straightforward, works well. If it's done well, it's about a 1 hour, maybe 1 hour and 15-minute surgery. The scars literally disappear. And literally, again, one of the happiest group of patients we have, because it's something that really just kind of opens them up. They can now go and do all those things they didn't want to do before because they don't have to worry anymore. So a lot of patients come to us who've already been somewhere else. They've had the gynecomastia treated, but they're not happy for some reason or other. And we try to then go in and see what's going on and then try to fix that so that it now looks the way they want. And there are two main reasons that they are unhappy. And all of them have to do with not doing a complete job. Some surgeons will go in and say, okay, there's some fat here, so we're gonna do some liposuction. And liposuction is a great technique for removing fat, but only fat. It doesn't remove the gland tissue that these guys have. So as a result, their chest will get smaller, but they'll still have a lump there from the gland tissue that was still left behind. So in those patients, we have to go in and then complete that. We have to go in, use an incision that's very hidden, and remove that gland tissue. Once you do that, boom, they're suddenly fixed. The other group, which I just got an email yesterday about, is a guy who went and had the gland removed. So the guy who did his surgery removed the gland, but didn't do the liposuction. So now it looks like someone took a pit out of a fruit. It's like a dent there. There's a little hole there where he just has an indentation with a fullness around it. That looks even worse because now there's an irregularity in his chest. So what we have to do there is go in and do the liposuction that they didn't do, and then use that to smooth everything out and check to make sure no gland left behind either, because you never know if someone else did the full job with the gland or not. So that's the other type where they have an indentation. And that used to be very common years ago when liposuction was less popular.